BLS is the precursor to ACLS, okay? If your BLS skills are poor, your ACLS skills will definitely be poor, okay? If your BLS skills, including the assessment, okay, are bad, then your whole emergency falls apart, okay? So we can't even really get to effective ACLS without making sure that BLS is effective and everything is done that is supposed to be done. Let me give you an example. We just had a recent celebrity pass away, okay? Michael Jackson, and there's quite a bit of controversy around what actually took place on scene prior to them calling 911. Okay, this is important to look at. Okay, the last that I have heard, and this is from watching the news and getting some of the reports, was that CPR was done on Mr. Jackson for quite a while prior to EMS arrival. Anybody hear that? Okay, okay, CPR was done prior to arrival. The problem here is when the patient was found, okay, he was still breathing and had a pulse. Okay? Question, do you do CPR on somebody that is breathing and has a pulse? Okay. Do you do CPR on somebody that is breathing? What if they're breathing and you cannot find a pulse? Not a trick question. They're breathing, barely breathing, but it's consistent, but you cannot find a pulse. What could that mean? They're almost dead.
They're not having a good cardiac output, so they could be like VFib or something like that.
Okay. If he was in VFib, he wouldn't be breathing. Okay? VFib means that the ventricles, actually the heart is just firing erratically. Okay? There's no rhythmic pump to the pump. The pump is not pumping correctly, so you have no cardiac output at all, which means you're not going to be breathing. Okay? What about a low blood pressure?
Isn't our goal to perfuse the brain? I mean, that's mainly we want to keep oxygen to the brain. If the person is still breathing, they're still getting oxygen to the brain, or they stop breathing. Exactly.
Okay. Remember this: if you have a patient who is unconscious, okay, they do not respond. What's the first thing you should do if you're not in an emergency environment already? What should you do? Common sense. Call for help. Call 911. That's what needs to happen. Okay? Unresponsive people who are breathing are alive still, which means that they don't get chest compression for us. They go in what we call the recovery position. Typically, we're going to put them on their side. Any idea why we do that?
Vomiting.
We don't want them to aspirate or anything like that. We put them in the recovery position, we call for an ambulance, and we monitor them. We reassess to make sure that they are still moving air. Okay? Now, the pulse check has been something that's been emphasized over the years, and in my opinion, sometimes a little too much has been emphasized. Number one, if I have a breathing patient, right then I know that the heart is working. Is that correct? Okay? The heart's working if they're breathing. Now, I'm talking about consistent breaths. Even if they're shallow, if it's in, out, and it's consistent, the pump is working. Doesn't matter if you can find it. If you can't find it, it could be a low blood pressure, it could be poor circulation, there could be a number of things that could cause that. Okay? It could be the temperature, it could be very cold, maybe the hypothermic. Okay? These types of conditions can make it difficult to find a pulse. What if the person's really large? Okay? 350, 400 pounds, it can be quite a challenge to find a pulse on this person. If I've got breaths, I've got somebody that's alive, they go in the recovery.